saw Senator Kreider somewhere on my screen and he switched positions. There you are.
I'm here.
Yep. So if you and Representative McNamara want to kick it off and for the presentation, I'm happy to share my screen and walk folks through it.
Sure. Go ahead, Wendy.
Sure. All right. Well, once again, thank you all for being willing to collaborate with us to try to help bring some juvenile reform to the state of Indiana. Nina is going to share with you today the initial findings of 30, I think, interviews, or a few more than that. Maybe she'll give you the specifics, but it'll give us the opportunity to kind of give us an overview of what the last few months have gotten us, and then where we need to go from there. I think, did we share the PowerPoint with them, or are you just going to share your screen?
I'm just going to share my screen. We didn't share it.
Okay. Yeah. Okay. All right. And other than that, I just want to express my thanks to all of you from around the state of Indiana for your participation in this, because as many of you know, it's near and dear to my heart, and we want to make sure that we take care of all the youth in Indiana, and we do so with the best possible way. And with that, I'll turn it over to my colleague, Senator Kreider.
Yeah, I just want to add my thanks. Getting a status of where we're at with information sharing is kind of the first step. And so thanks to everyone that participated, and look forward to discussing next steps after Nina's done.
Great. Well, thank you, Senator Kreider and Representative McNamara, and thanks everyone for joining. Happy New Year. Hope everyone is doing well. It's been a little while since we connected. I'll share my screen and go through the presentation, but today the goal is really to share some initial findings and emerging themes from the various stakeholder conversations that we've engaged in over the last several months since our first task force meeting. And then all of this information with our review of statute, review of policies and other materials that we've looked at, and some additional stakeholder conversations. We'll take all of that information and present it in a summary report for our last meeting, which we need to schedule sometime this spring, as well as some preliminary recommendations. So we won't get into any recommendations here. We just wanted to share emerging themes, emerging priorities from our conversations, see how those resonate, and see if folks have anything to add to that. So I will go ahead and share my screen. There we go. Okay. And I won't provide too much of an overview in terms of, the project and the initiative. I think most folks were at the first meeting or have since received materials or have spoken with us. But also for those on the live stream, just as a reminder, I'm Nina Solomon from the Council of State Governments Justice Center. I'm joined by Emily Rogers and Josh Weber, my colleagues today. The Council of State Governments Justice Center, we're a national nonprofit, nonpartisan organization that supports state policymakers in all three branches of government with criminal and juvenile justice issues. And we began our partnership with Indiana back in the fall in conversations with Representative McNamara and Senator Kreider to conduct this preliminary assessment of the juvenile justice system. So just as a reminder, we set up this task force being co-chaired by Senator Kreider and Representative McNamara to help oversee and guide the preliminary assessment process. You can see we have, we won't do a roll call or anything because I think that'll take up a lot of time. We do have one different member here than we had last time, with Terry Decker taking over the Division of Youth Services in place of Angela. So I know that she's on the line today. And we have reached out and spoken with almost all of the task force members individually or through focus groups since October to get a sense of their priorities and challenges. And for those that we have not yet reached, we will continue to try and get in touch and set those up before our next meeting. Just as a reminder, in terms of the process and the goal, as I mentioned, the goal is to develop a summary report for this task force that helps position Indiana to develop a statewide plan to improve the juvenile justice system and make it more effective so that it ensures public safety while also improving outcomes for young people and reducing disparities. And we're employing a range of methods in order to accomplish that, in order to develop this summary report, including our conversations with stakeholders to identify priorities and challenges in getting better outcomes for young people, looking at current and previous reforms that the state has already engaged in so that we can build upon those reforms and build upon those strengths of the system. Looking at state statute and resource allocation decision making and seeing how that aligns with research and best practices. And then I think one of the key pieces of this preliminary assessment is examining and evaluating the state's capacity to collect, analyze, and use juvenile justice data across the system so that you can answer key questions about system performance and youth outcomes to drive decision making. So all of those methods and all of that information will be included in that summary report that will be delivered to this task force in the spring. So as Representative McNamara started to allude to, since our first task force meeting, we have conducted over 30 interviews and focus groups with about 100 stakeholders across the state, across the juvenile justice system, to identify challenges, opportunities, priorities for improvement, as well as to learn about how the juvenile justice system in Indiana operates, because every state is very unique. And we know in Indiana, every county can be very unique as well in terms of how you interact with the juvenile justice system. I sent out with the agenda a list of stakeholders so you all have a sense in terms of who we've spoken with from various organizations and agencies. We do intend to have additional conversations in the next couple months before the summary report. And we'll ask folks in this meeting at the end of our conversation to identify other constituencies, other stakeholders that we may not have yet engaged with that you feel are important for this conversation. And you can see on the right-hand side that we already know that there are additional conversations we need to have, particularly with law enforcement and behavioral health. We've had a number of conversations with school resource officers, but have not yet connected with local and state police agencies. And so would really want to do that in prep for our final meeting and for the summary report to get their perspective, as well as some additional behavioral health agencies and providers. In addition to that, we conducted over 20 interviews with various state and local agencies to better understand how Indiana is currently collecting and tracking juvenile justice data. So looking at state agencies from the Department of Corrections, Office of Court Technology, DCS, and so forth, as well as conducting interviews with 12 different county probation departments. And we'll get into that a little bit more in a few slides, where we ask questions around what data systems they're currently using to track data, what questions they're able to answer with their data, where there are challenges, and how they can match data across the juvenile justice system. So we want to thank everyone for answering our emails and our phone calls and for getting engaging in these conversations with us. We found it extremely helpful and feel like we learned a lot about the system, and folks were very honest and open in sharing their challenges and priorities. So some initial takeaways and emerging themes. So first, as I mentioned, we always want to, when we're partnering with states and counties, build off of the work that has already been done. We know we don't come into a state in a vacuum, that a lot of good work is already underway and has been for some time. And so we want to recognize that and build off of those strengths. So I just wanted to share a couple of those here in this slide. I'm sure there are others as well. But JDAI, obviously being a large focus in Indiana since 2006, when the state joined the JDAI initiative. to reduce the number of young people that were being sent to secure detention and to create alternatives to detention in the community. We now have 32 counties, I believe, that are participating in the JDAI initiative. And that represents about 70% of youth in Indiana are residing in a JDAI county. So a large majority of young people are in a county that engages in this initiative. Additionally, through JDAI, participating counties have developed processes for more robust data collection, protocols to be able to collect various juvenile justice data and use that data to understand and answer questions about the juvenile justice system, including creating shared definitions for data elements and reporting on a regular basis so that folks in these counties can understand what's happening in their system and make decisions accordingly. So that is a great infrastructure for data that I think the state can build upon as we are thinking about recommendations for improving data infrastructure and data capacity. Also in Indiana, a dual status framework was established in statute a few years ago that helped to improve coordination and the relationship between DCS and juvenile probation departments to better serve youth that find themselves in both service systems, including the development of MOUs between DCS and local probation departments, the use of a dual status screening tool, creating an assessment team to help respond and provide services to young people that are in both systems, and as well as how to share information and data across DCS and probation. So that's another strength of the system that I think as we move forward and think about recommendations that the state can build upon. So I'll start with the data piece, and I'll ask Emily to jump in as well as I'm going through these slides, since she engaged in the majority of the data conversations and can speak this language much clearer than I can. But one of our biggest takeaways from our conversations so far with data folks across state and local agencies is that the capacity to collect and track juvenile justice data and youth outcome data for youth in the system is fairly limited. We've identified that multiple data systems, and a lot of this information may not be a surprise to some of you, but multiple data systems are being used by state and local agencies to collect and track data on youth in the juvenile justice system. And also that Indiana does not have a unique identifier for each young person in the juvenile justice system, so that you can follow youth across these various data systems and across the juvenile justice system from point of referral through their case in the system, which is critically important because that makes it very challenging then to look at outcomes as well as to look at what's happening at key decision points and how they build off of one another as youth move through the system. And I'll explain that a little bit more in the next slide. We have a chart that shows the various data systems that are being used and how these data systems cannot be linked or matched to one another. In addition to the various data systems that are being used, we also notice that key data points are not collected at all or cannot be analyzed in Indiana. Or can't be disaggregated by certain populations or subgroups. So we don't have a single source of juvenile arrest data in the state. A lot of the data that is being collected by various agencies cannot be disaggregated by prior history of offenses and referrals or prior adjudications. They can't be disaggregated by risk level to see if youth are being matched appropriately to supervision by risk. And in some cases, even some of the data sources cannot disaggregate the data by key demographics, by race, ethnicity, et cetera, which is critically important as you're trying to look at disparities across the system. Additionally, one challenge in looking at trying to look at direct files and waivers, which I know is a priority issue for folks in the state, that there wasn't a flag or a code that exists in court data for those types of cases. And I'll let Emily explain that a little bit more in a second. And there was no automated match or flag in a lot of the data sets for youth that were involved in the child welfare system for those dual status youth. So just to give a sense of these multiple data systems, I wanted to share this chart, and hopefully it's as accurate as we could get. There might be a few additions or changes since we had a couple more conversations in the last couple days. But you can see here on the left-hand side, there are 6 different case management systems that we know of that are currently being used by local juvenile probation departments across the state. 35 counties are using Odyssey, 38 counties are using a system called SRS, 4 counties are using CSI, 2 counties PBS, 12 counties, I believe some of the largest counties are using Quest, and another county is using a completely different system. So a lot of different case management systems in place. And at the same time, within these counties, they're not always using the same court. The courts are not always using the same system. And so it's very difficult sometimes, even within probation case management, to link this data back to court referrals and to the court data. And again, I'll let Emily explain that a little bit more. You can see on the right-hand side, the other data systems that are being used by other state agencies that do not link to the case management systems used by probation. So DOC uses a different data management system for youth that are in that part of the system. DCS uses a different data system to track service referrals as well as financial information for youth receiving services through those contracted programs. Juvenile detention data is captured in a large data system, Insight, which has, I think upwards of 10 or 20 different modules within it, including the risk assessment data. And then again, the juvenile courts are using Odyssey or Quest, but not always the same system that's being used within the juvenile probation department in that county. And so that makes it really challenging, again, to analyze the data in across the system and to look at recidivism, to look at other positive youth outcomes when the data cannot be matched across these systems and you can't follow a young person from point of referral as their case moves forward. And so, Emily, I want to turn it to you just to see if you have anything to add to how I summarized some of the data challenges, given that you were involved in all of these conversations, but also I thought it was a good opportunity for Emily to also share an example of a state that has a similar governance structure in terms of state local, with most probation departments being run at the local level, to share how they're tackling this issue and how they've been able to set up data systems that are connected to one another, even though each county, and she's going to share about Texas, even though each county is not necessarily using the same data system, they can talk to one another. But I thought it would be good just so that you all don't feel so daunted by this information, that it has been done in other states that are similar to yours. So Emily, do you want to anything to add just about my summary? And then also if you want to talk a little bit about Texas, I think that would be helpful.
Sure, thanks, Nina. So as Nina said, there are lots of data systems in place. It's not necessarily a bad thing to collect data in a lot of different places. So having a lot of different systems is not the challenge, but I would say the challenge is more having the data become uniform so that it can be collected at the case level and turned into the state. So as Nina had mentioned, Texas is also has a county-driven probation system, and they to solve this problem, they created standard definitions for the different points in the juvenile justice system, and then counties are responsible for submitting an extract that contains case level data. So one of the big challenges in Indiana is a lot of the data is reported, so there's the ability to collect it, but it's often collected at the aggregate level, so you have counts and not case level, so you can't necessarily follow a case over time. You can't look over time when you don't have the case level data. So it's definitely a challenge, but it's not an insurmountable challenge. So we bring up the example of Texas just as an opportunity to show you that just having multiple data systems in use is not necessarily the problem, that there are ways to address that. In one of the problems that I think didn't really make it into the slide was that counties are having to do a lot of workarounds to meet all their reporting requirements and often doing duplicate data entry. And the reason they're having to do that is because systems often don't connect and they don't talk to each other, which again is a technical problem that can be solved. So it isn't insurmountable just having that challenge, but it does require agreeing on a set of standards and solving the technical problems that underlie that. So I think that there are opportunities in Indiana to improve data collection so that you can get the types of outcome information that you are looking for, and that you're able to do the types of performance measures that you want in order to see if the system is working.
Thanks, Emily. One more slide around the data, and then I'll stop at that point before we get into some of the emerging themes and priorities from our conversations. In addition to the multiple data systems and the difficulties that presents for tracking data across the system and across time, we also saw that there's a lack of coordination at times as well for the collection and use of data, that even within the current data collection processes and existing data systems, that there are some quality control issues, that not all information is being entered into the existing systems in a consistent manner with similar definitions. And some information may not be entered at all across the board, or is missing entries for demographic information or end dates for supervision or for outcomes. And so I think, as Emily mentioned, that's some, I think, more low-hanging fruit data issues that can be remedied, without this thinking about this larger issue of how do we build up a data infrastructure that she talked about, like Texas has. But I think those are some other issues that we identified through our conversations. And then that minimal outcome data is being tracked or looked at in Indiana to drive decisions. So we do know that DOC calculates recidivism and reports recidivism data, but is really only using reincarceration as their key event to measure and calculate recidivism, not looking at re-referrals to the system or re-adjudications, which I know is partially in part due to limitations with how they can connect their data system back to court data. But that's a gap in terms of looking at outcome data. In terms of probation departments, there are some probation departments that are looking at recidivism data, but a lot of departments are not. And if they do, they often have to hand match the data in terms of their case management system back to court data and other data in order to calculate recidivism, which I know is extremely challenging and very tedious. And then in terms of service outcomes, there's very little outcome data available around services that youth are engaging in when they're on probation or in the juvenile justice system. And so a lot of decisions are not based on outcome data in terms of referrals to services. So that is another gap in the data that I think can be addressed when we make recommendations moving forward. Before we get into the policy piece, and I don't know, Representative McNamara, Senator Crider, if you have any reactions to this information, I'm happy to also move forward with the policy discussion, priorities, and then have a conversation at the end. But I also thought it would be a good point to stop and check in briefly about the data and see if folks had comments or questions.
I don't know how to turn myself back on, but all right. Nina and Emily shared this information with us last week. My takeaway was just a little bit of shock and more concern, I think, and trying to figure out how we do a better job of communicating and collecting data in Indiana so that we can actually get an accurate picture. I was frankly disappointed at just the lack of ability of us just to, you know, have a, I don't want to say simple fix, but have a good look in accurate data. Anybody who's on the committee who has any thoughts, who wants to weigh in, you don't have to ask my permission. You may go ahead and do so. But that was just my initial takeaway. I was just more shocked than anything to really learn about the difficulty in tracking a particular juvenile from beginning to end, and being able to have, I'm just going to say, reliable data to be able to make informed decisions.
I'm going to stop sharing so I can see people if they have any comments or questions.
Good afternoon. This is James Garrett, and I want to echo those comments from Representative McNamara. I've been with the Commission on the Social Status of Black Males since 2005, and we do an annual report. And gathering data has been more difficult than pulling teeth. And to get quality data that's been disaggregated that can help you formulate recommendations, it's just been a challenge. And I mean, and it's been a challenge not only as it relates to juvenile justice, but data through the Department of Correction, data through the Department of Education, and even the Department of Health. You know, and this pandemic that we're going through right now, it again is still challenging to get good data, disaggregated data by gender and ethnicity to formulate, again, recommendations on how to best provide the vaccines now that we have them, or to address other health disparities that are impacting Black males and other minorities in the state of Indiana. So yes, it is a challenge, and I was surprised to see that there were so many different systems that county offices are using, but I guess I really shouldn't be surprised.
Other reactions or questions?
If I could, this is Tammy Silverman from Indiana Youth Institute, and we're just about ready to publish our 2021 data book. And I would just echo what James said, is that, you know, one of our goals is to disaggregate the data and analyze the data, but also compare it, for example, to school expulsion or suspension rates. And to be able to do that amongst different departments in the state, you know, it needs to have comparable structure and access. So I would just echo what he had said.
Well, good news is we can fix it. Everything is always fixable. So
Yeah.
that's the bright side.
And Madam Chair. Madam Chair.
Yes, King of Kale.
Queen of Kale. I think the report's well done. I think it would be helpful if we had, all of us had an opportunity to digest that and provide some information that would be in form of editorial suggestions to it. For example, the SRS system is a relatively new system that's being rolled out, state of the art, but it's within the Odyssey case management system. So it doesn't really compete with the Odyssey case management system. It's really a complement to that, I believe. And I think the other piece of very good news is if Emily and her team would have done this 2 years ago, certainly 3 years ago, certainly 5 years ago, this report would be much different, much worse. So if you look at the stock price, it's not where you want it to be, where we want it to be, but I think progress is being made. And I would suggest that the group consider going forward as it relates to data collection and the ensuring data collection and data sharing, it's not always been a high priority among all of the different persons and entities, that a system of incentives or disincentives to help people understand that in their job today, collecting that piece of data is not really important to them, but educating on the big picture, how important that little bit of data is. I thought it was well done and well put together, just like the opportunity to digest that and make it even better.
Yeah, and I know, Josh, you had something to say. So I appreciate that, and that's what we're looking for. We want to obviously make sure that what we captured is accurate, and want the whole picture. The goal is to take this information and all the information we gather between now and March or so, and put that together in a summary memo in a kind of narrative form, and then present that final report back to you all in April. So between now and then, would want to connect with you all again to make sure that what we have is accurate, and to get your thoughts and feedback before that presentation. But Josh, go ahead.
Yeah, I guess just a couple of notes. I mean, first, just building on what Nina said, the goal today is really just to provide, a broad sense of themes and general findings. When we provide the more substantive and detailed memo to this group, we'll certainly be laying out a lot of these issues in more detail, a lot more of the specifics. And as Nina said, that's why in the meantime, we'll have follow-up conversations with many of you to make sure not just what we're saying is accurate, but that we do get those details right. But just a couple of quick notes about data, because what we'll be asking of this group at the next meeting, where you'll have had time to see this more detailed memo and digest it, is to identify your priorities for system improvement, and then what that means in terms of next steps, in terms of both further examining those priorities and ultimately coming up with solutions. And so in terms of data, when we often work with jurisdictions, data tends to be an afterthought rather than foundational. But I think as Nina and Emily just articulated, if a state doesn't have the data infrastructure in place to really not just understand how youth are flowing through the system, but to know whether the system is actually implementing research-based policies and practices to match kids with the right level and type of supervision and services, and ultimately, is the system performing effectively in terms of recidivism and youth outcomes, then any improvement efforts really are sort of shooting in the dark. And so we often say, improving your data infrastructure, however complicated, messy, and sometimes costly, can be a jurisdiction's #1 recidivism reduction initiative and the most ultimately cost-effective initiative. We know this is complicated, but just sort of food for thought as this process moves forward, just to encourage you to think about how data can be foundational and really shouldn't be used to evaluate things after they're done, but really should be used as a foundation to help guide policies and practices that are designed to improve the system. And along those lines, just to build on what Rep. McNamara said, we know this can feel daunting because as the picture that Nina just painted, right now you've got a whole bunch of different systems being used in different ways, a lack of research and data capacity. But other states that have really committed to this as a priority, as Emily talked a little bit about in Texas, but Texas is not the only example of a state that has a primarily locally driven juvenile justice system, but has decided, for all the reasons that we've articulated, that they need to have a centralized approach to data collection. So whether it's Oregon or whether it's Pennsylvania, there are states that have county-run probation systems that have all decided to prioritize the establishment of statewide systems, statewide performance measures, statewide infrastructure to make sure that data collection is consistent and is operating at a certain level across the state. And we can share some of those examples at the next task force meeting. So big challenge, but also a really important one to tackle, and examples from other states with a similar system to Indiana's that have successfully tackled it.
And I think the other point to add to that is at the next task force meeting, when we think about next steps and present this information in more detail, along with some preliminary recommendations, I think we'll have some kind of more low-hanging fruit recommendations for data that aren't super costly and time intensive. And then obviously the more structural questions and recommendations that will take longer for you all to build out. At the same time, I think the issue around data will drive next steps in terms of, given the current capacity in the state in terms of data collection, what are the key questions that we can answer in a more comprehensive assessment? What are the priorities? And we'll get into emerging themes and priorities in a minute. But where do we have the data to really analyze those issue areas? Where can we do a deeper dive assessment if we can't do a macro level entire system assessment, just given some of the matching challenges? So I think that the data piece will also drive the conversation in terms of next steps for that comprehensive assessment. Any other comments right now about data? And we can go on into the emerging themes as well and come back to it. Yep, okay. I'll go back to sharing my, okay. So in terms of our other conversations with stakeholders beyond data, so one kind of overarching theme that came through in all of our conversations is that what we noticed and what the conversations revealed was variability, and I know that's not surprising to folks on this call, across the state in terms of how youth are interacting with the juvenile justice system, how they move through the juvenile justice system, as well as how policies and practices are aligned with the research and with best practices. Just varies considerably from county to county. So I just wanted to provide some examples of how that manifests itself in the state. So for example, in terms of diversion, for a lot of counties, informal adjustment was the main and often only option for young people to be diverted from the juvenile justice system, those young people that have committed low-level offenses or are at low risk to reoffend, while other counties do provide pre-arrest or pre-court diversion opportunities for young people. We saw examples of law enforcement agencies handling kids committing low offenses outside of the juvenile justice system and referring those young people directly to diversion programs, whether that's restorative justice or substance use treatment programs for youth committing low-level substance use offenses, or other community-based services without getting probation involved. We also saw, in terms of status offenses, so kind of similar in terms of low-level behaviors, the approach to addressing youth with status offenses differs considerably across the state. We saw a number of counties that rarely refer youth that commit a status offense, like truancy or curfew violations, to juvenile court. Some that have created their own truancy programs outside of juvenile court. And at the same time, we saw a number of counties that are still referring most of their status offenses to juvenile court, and even some that are using detention as a sanction for young people that are committing status offenses. So great variability across the state in terms of how jurisdictions are handling those low-level offenses and youth that are low risk to reoffend. In terms of detention, we also saw variability in how counties are using a detention risk screening tool, whether that's the JDAI screening tool or another kind of county homegrown screening tool, to inform the use of secure detention. And in a bunch of counties that we spoke with, there was no such tool that helped them to inform that decision, whether to place a young person in detention or to release them to the community, to their home. We also saw variability at the deep end of the system in terms of probation policies and practices varying considerably by county in terms of how youth are supervised, their contacts, what case management looks like. And at the deepest end, with how young people coming out of DOC are supervised and serviced upon release and reentry back into the community, with some local probation departments picking up jurisdiction, again, for young people released from DOC back to their communities, while in other jurisdictions, youth coming out of DOC have very limited transition support and supervision from probation or DOC or any agency. So again, I think what this says is that oftentimes, depending upon the county that you reside in, it will inform the kind of way that you're interacting with the juvenile justice system and the opportunities available. And so that lack of consistency in terms of how policies and practices are aligned with research and best practices is one of the biggest takeaways, I think, that most folks on this call will not find surprising. In terms of some of the additional concerns or priorities for improvement that emerged from our conversations, we saw kind of going along with the inconsistency that I just described, that most stakeholders actually expressed a desire for more opportunities to divert low-risk youth committing low-level offenses away from the juvenile justice system prior to them getting involved with probation in the court, so more pre-arrest diversion opportunities. And a number of stakeholders expressed their support for addressing status offenses outside of the juvenile court and supporting those young people through another service system. Another concern that was raised was that the use of the IAS, the Indiana Youth Risk Assessment tool that's in place, that minimal weight was being given to the use of that tool in key decisions in matching young people to supervision and services for a number of reasons. There were some concerns raised about the validity of the tool and some of the questions on the assessment, but also questions raised around training around the use of the tool, as well as when that tool is conducted at disposition. And so the timing makes it challenging for that tool, for the results of that tool to be used to inform dispositional decision-making. We heard from folks that probation was often a one-size-fits-all model rather than having probation supervision tailored and individualized to each young person, whether that's conditions of supervision or contacts or the types of services that young people were being referred to, and that youth were not always being matched to the most appropriate services based upon their risk and needs. And there was a sentiment from a number of stakeholders that residential placement was being overused compared to community-based services. And we'll go into some of the reasons why. Obviously, in some rural jurisdictions, they expressed that there was a lack of services for particular needs. And so as a result, young people might be referred to residential placement to get access to those services. Some other challenges and priorities that emerged from our conversations, again, building off of the service concern, gaps in rural jurisdictions, a lack of more intensive behavioral health and substance use services, as well as services for parents and for the entire family, like family therapy or other home-based services. And then concerns were raised around a general lack of services that were tailored specifically for juvenile justice populations. That a lot of services were used to address vulnerable or at-risk youth in general, or to serve youth in the juvenile justice or delinquency system, as well as youth in the child welfare system, but that services were not always tailored specifically to reduce recidivism or to reduce the likelihood of young people committing another delinquent offense. Limited outcome data about community-based and residential services was also raised. Folks were really wanting to know more about the effectiveness of the services that kids were being referred to, as right now, a lot of those service referral decisions are made based on relationships with particular providers, geography, obviously trying to keep young people close to their communities, and other anecdotal evidence, but not a lot of data being collected or shared with probation or other stakeholders around outcomes of those services and of those providers. We talked earlier about the dual status framework that is a strength of the system and something that folks want to build upon. But folks did express some challenges with implementation fidelity across the state. So kind of going along with the inconsistency frame that we talked about in the beginning, or the variability across the state, and that there was some lack of transparency in information sharing across the systems, even within the dual status model or framework that the state has adopted. One of the key priorities that I think we heard from almost every stakeholder group that we spoke with is providing additional transition and reentry supports for young people that are released from DOC custody back into their communities, whether that's employment, housing, educational connections, as well as for youth coming out of residential placement. But that transition or reintegration support was something that was needed across the state. And then lastly, we heard concerns or challenges around trying to match those highest risk youth, those youth that are committing the most serious types of offenses, with what is the most developmentally appropriate supervision, and at the same time holding those young people accountable and promoting and ensuring public safety. So a lot of comments were raised from various stakeholders around the direct file and waiver statutes, as well as, you know, how can those young people be served in a way that is developmentally appropriate, but at the same time recognizes the seriousness of their offense. So that was definitely an issue. And I know that is something that a lot of folks on the screen have been talking about. I know that the legislators on the screen have also been hearing about that from other stakeholders as well. I want to stop there again before we get into next steps, just to hear about reactions, and maybe I'll do this, actually reverse the order a little bit before we get into next steps. I think this is our key question for this section. Do these challenges resonate with you? Are any of the information, any of the points that we made surprising? Are there other priorities or themes and challenges that are missing from this very quick summary? And again, as Josh mentioned, this is a preliminary look at some of the themes that emerged from our conversations. We obviously will present this in a more specific and detailed format in the memo, as well as a review of state statutes and other policies and how those are aligned with the research and best practices in the memo. We didn't want to get into that today, but I'll pause here just to see. I'll start with you, Representative McNamara and Senator Kreider, if there's anything, any additional themes or priorities, or if these challenges resonate with you, or anything that's surprising to you.
You got to stop turning me on and off.
I can do it.
I can't. I have my iPad from, and normally I have my computer, and I can't figure out how to use it, and I keep swiping you guys off. All right, I'll let Senator Kreider go.
So I don't think that there are any surprises necessarily. I think the themes that you identified do resonate there, that we do need to try to identify ways to be more consistent with the application of the law and the statutes. It's not surprising that, to me, coming from a law enforcement background, that different jurisdictions handle things differently. To me, that may be one of the biggest challenges going forward, to try to establish some type of consistency, because we've got 92 differently elected prosecutors, and we've got judges that are from all different corners of the state, different backgrounds, and so but the data piece, if we can understand more about what is happening, I think that will help folks better identify, and maybe better opportunity for us to achieve buy-in into the direction that the state needs to go.
Other reactions or thoughts, anything missing? I see Joel, you have a comment on the side, so I'll call on you.
Yeah, I just wanted to echo Senator Kreider's comments. I think the lack of data and not knowing what's going on in the individual counties causes some of the disparate ways in which the counties treat youth. We get counties that don't really know and pay attention to what other counties are doing over time, and they do their things the way that they've done for however long it is, and they get ingrained in that practice. And they also get used to using the same residential placements over and over again, and may not know and understand or to look elsewhere for, each kid is unique, and all of these residential placement facilities are unique and different, and are going to have different strengths and weaknesses. So I definitely have been concerned about this for a few years. The drastic distinctions that I see in some counties, especially with kids who are ending up at the DOC. One county may send a kid for a certain offense type, but not until they violated probation 10 or more times on that offense, while another county for that same offense, you get your original adjudication and one violation of probation, and you might find yourself in the DOC. So I think those distinctions are starting to lessen as with our work through JDAI. Nancy's doing a great job with that. And I think maybe even a little bit of the work of the public defenders being educated and making a case for, bringing things and making things more consistent across the board. But until we get that data shared and until we can know what's actually going on throughout the state, it's really hard to balance that out.
Other thoughts? I know, Nancy, I see you have a question about if anything related to race, equity, or disparities came up in our conversations, and they did. I'll let Emily talk a little bit how it came up in her data conversations, but yes, it came up a lot in terms of youth, different youth getting treated differently in the juvenile justice system. It came up a lot in terms of the direct file and waiver conversations, as well as around service provision and kind of the lack of culturally responsive services for certain populations. But also, again, without the data challenges are probably the biggest challenge in terms of race, equity, and disparities, and just being able to look at the data and disaggregate it across different race, ethnicity, gender, et cetera, subpopulations was probably the biggest challenge that we heard related to equity issues. Emily, anything else that you heard?
Yeah, I think I would add 2 points to what Nina said. The first is just the lack of information on the front end of the system. So from the point of referral, it's really hard to find out what happens to all of the referrals in Indiana, what the ultimate disposition is, and that was the place where data collection was the weakest as well. So when we heard about not knowing some of the demographic information of youth, it was really more on that end of the diversion side rather than what the supervision or placement side, where there was a lot of contact with the youth and opportunities to collect that information. But the front end of the system was lacking in that information at points. And then I think the other challenge that came up with race equity was the current report, the current racial and ethnic disparities report is limited in one of the things you want to look at when you're talking about race equity is to be able to follow the youth through the system. So of the referrals that take place, how many of those are ultimately disposed to certain dispositions? Are people treated differently? Are they winding up in the deeper end of the system more often? And that is currently a challenge with the current way that data is collected because of the limitations in Indiana, not being able to follow youth through the system. So that's the other area that that I identified some need for improvement.
I think it also speaks to why we're highlighting some of these themes, which is, if folks remember in the first meeting that we had, we sort of gave a very quick tour of the research and what research shows really works to reduce recidivism and improve youth outcomes. And on one hand, some level of local variability is to be expected and is actually helpful to ensure policies and practices are tailored to specific populations. But in terms of some of the themes that Nina has articulated, we know, for example, from research that diverting low-risk youth, like youth who commit status offenses or other youth who commit low-level offenses out of the juvenile justice system is actually likely to get you better public safety outcomes than having those youth be formally involved with the juvenile justice system. We know that consistently identifying kids' risk of reoffending and their criminogenic needs and matching them with the appropriate level and type of supervision and services is also critical to recidivism reduction. So to the extent that risk assessments exist, but people don't trust them or people aren't consistently using them to guide decisions or aren't trusting them to identify young people's key service needs, and then matching them with appropriate services, that's going to result in worse outcomes. It's not only going to result in worse outcomes, but the distinctions mean that instead of objective sort of research-based information guiding policies and practices, other things start to guide it. And so it becomes justice by geography, or, you know, to Nancy's question, justice by your race and ethnicity and being treated differently based on what you look like or your gender or where you're from or your level of resources that are available. So the themes that we're pointing out aren't just kind of inconsistencies, but they're a not consistent alignment statewide with what we know from research and best practice is critical to getting better outcomes and critical to getting better outcomes equally with all populations, regardless of where they come from or their gender or their race and ethnicity or other kinds of specialized needs.
So two other themes that I see in the chat that did come up. Chief Lyday mentioned around training for school resource officers or other police who work with young people to help them determine when an arrest is appropriate or not. I know you're talking specifically about school resource officers, but that is another theme that we heard more broadly around training and consistent training around adolescent development, de-escalation, how to work with young people, research and best practices in juvenile justice. That's a theme that we heard for all stakeholders in the system, whether it's public defenders, prosecutors, judges, law enforcement, was something that folks felt would be very helpful to have that for some stakeholders that don't currently have that, or to strengthen that for most of the stakeholder groups working in juvenile justice, and also to do cross training so that you're not just having training in silo, but that folks can connect with one another and receive the same type of training. So that was another theme that did come up in our conversations. And then Angela, do you want to talk a little bit about how the theme resonated in terms of the dual status piece?
Sure. So I just wanted to mention that we were not surprised by the comments that you had received. That is something that we have kind of known for a while was an issue. So there is a dual status work group that is on the court side of things, and then there's the Juvenile Justice and Cross-System Youth Task Force of the Children's Commission. So we are actually planning, and invitations went out earlier this morning, as a matter of fact. So we're combining our efforts to improve the dual status outcomes, to help clearly identify the purpose of dual status and how we want to move forward with dual status. We're also working on updating the resource notebook that was prepared back when the statute first passed, and also training.
Great, thank you. Other comments, reactions to the emerging themes and priorities, anything that's missing from that list that you would want to make sure we engage in conversations about going forward. Look through my screen. Okay. So again, this was supposed to be just a very initial broad summary of the conversations that we've had. We want to have additional conversations between now and our next task force meeting, which we need to set sometime probably in April, to flesh these out a little bit more, so that we can draft that summary report and kind of align that with our review of statute and other policies and materials that we're looking at for that summary report. To that end, before we get to next steps, the list of stakeholders that I had sent ahead of time, there were two tabs. There was a kind of a policy tab and a data tab that outlined the various organizations, entities, individuals that we have spoken with. There are some stakeholder groups that we have not connected with and are having some difficulty, particularly with law enforcement. Obviously, there's a lot going on right now that impacts law enforcement. And so understand that connecting with some stakeholder groups might be more challenging. But wanted to ask you all as well, if there are other people that you don't see on those lists that you think that we should talk to, other stakeholder groups that we need to engage to get further buy-in into this whole process as we do move forward. And then any strategies for connecting with some groups that we have not yet connected with that might be more challenging. We can do that here. Obviously, if you want to send some of that over email, we're happy to do it that way as well, but wanted to pose that question this afternoon.
Yeah, just I think I'm a very analytical person, so I'm still digesting information. Is this going to come back to us in some sort of memo so we can kind of walk through or think through before the April meeting, so we could come back with more, I guess, question comments? Because again, at this point, I'm digesting a lot of what was presented today. Nothing surprises me from being in this field for 33 years in Indiana, especially the data piece and the services piece. There's the themes. So there's nothing really there to surprise me, but it's still taking into account and digesting that information.
Mm-hmm. Yeah, that's a great point. So yeah, so as we mentioned, we're going to take all this information, make it obviously more specific and flesh it out with our review of statute and other materials, and present that in a narrative summary memo for this task force. We will be sure to send that out, unlike these presentations, to the group beforehand, so you do have an opportunity to digest and think through comments or questions that you might have. And we'll probably also share ahead of time a few key discussion questions and questions that we want the group to be able to answer at the task force meeting. So yes, we will definitely plan to do that. And this, I know this preliminary presentation or this presentation on initial findings is going to be posted or shared with you all somehow as well. And then Joel just asked a question about if we've done virtual town halls in our other state reviews. So we've actually done them in person because they were during non-COVID times. We're typically, when we do these assessments, we're in the state, traveling across the state, engaging in focus groups in person. What we're hoping to have more conversations virtually, obviously in the next couple months. And then if we move forward and do a deeper dive comprehensive assessment, we try and do a lot more of these stakeholder conversations in all the various jurisdictions. We meet with youth and families that are most impacted by the system. Obviously, we have to do that in a virtual way. We will. I know we all hope that at some point soon, COVID will be behind us and we are going to be able to travel. But yes, we can do that in a virtual way if we can't do that in person. Any immediate thoughts about other stakeholder groups or individuals? No. Okay. So then, and I thought this meeting could end early, and I don't think anyone will be upset about that. In terms of our next step, so again, conducting additional conversations, drafting that detailed summary report with findings and initial recommendations from our assessment based on our conversations, our review of data capacity, our review of statutes and other materials, presenting that to this task force in April, and then engaging in conversations around the priorities for improvement and next steps for how we can conduct a more in-depth assessment based on available data, and having data collection and infrastructure be a key part of that priority conversation, and then moving forward with how to build consensus for policy change as we go through that process. In terms of the next task force meeting, we can work with Representative McNamara, Senator Kreider, Julie, to try and set that date, obviously working around the legislative calendar and other things that might be happening in April. And then we can also think about how to present that summary report to other legislators, the commission, other stakeholder groups that you think would be important for that information to get to and for us to disseminate that information to. Anything else, Josh, Emily, that you want to say at this point? Okay, Representative McNamara, Senator Kreider, anything that you want to add?
Just again to express my appreciation to everybody for being a part of this as we try to bring about positive impacts for Indiana. I'm a firm believer if we prevent them from going into the system, we won't have to worry about them being in the system. And in the long run, that saves us a lot of money in the state of Indiana, but also builds us healthy kids. So that's what I hope we get out of this. So appreciate all your help and support in making that happen.
Yes, thanks everyone for your time today and participating.
Great, and for those folks that we haven't yet connected with individually on this call, we will intend to do so in the next several weeks. If there are other folks that you want us to connect with, please feel free to email them to me directly or email them to Julie or Representative McNamara, Senator Kreider. And we will be setting that next task force meeting date soon so that we know when to get the materials to you all ahead of time. But thank you all so much for being on this meeting, but also for answering our emails and engaging in our stakeholder interviews and conversations. Thank you.
Nina, this is James Garrett. I have not been ignoring your emails. I've been awful busy. And
I wasn't going to call you out, but
I'm calling myself out. I'm going to make it a point to carve out some time so that we can have that discussion. And I'm kind of like Don. I need to kind of take a look at something and do a deep dive analysis of it because I think that there may be some other target groups that we may want to engage in the conversation. I just I'm proud to be a part of this task force, but one of the things that I've thought about since our last meeting several months ago was youth representation, since we are looking at juveniles, and so I'm hopeful that maybe in my interaction with you, Nina, I can suggest some youth organizations that can be approached to get their perspective.
Yeah, that would be great. So I know Julie connected me with a couple different organizations, a youth organization as well as a parent organization, but I haven't really gotten good responses in trying to set up conversations with young people and families before this meeting. So yeah, I would love your thoughts on that. Great. Well, thank you everyone for taking the time. I appreciate it. And we'll chat with you all soon.
Thank you.
Thank you.